So, Doc, you were just in Los Angeles, right? And you called parts of it the epicenter of healthcare fraud. Now, before we get into the nitty gritty of this, what kind of fraud are you talking about, and what is the scope?
So let's talk about the kind of fraud because it's particularly alarming that we're seeing hospices, which again are designed for people who are terminally ill and are going to die within 6 months. We see home health care. These are services provided to people who need desperate support in their homes. So they're trusting someone to come in there and provide these services. We see fraud in home and community-based services. These are the kinds of things that your family would do for you normally, but for whatever reason, your family is not around. So
Right.
driving you to a doctor's appointment, getting you home after hospitalization and taking care of you and bathing you and bringing the groceries up for you, do the shopping, all the kinds of things, again, that your family would do. But since there's no licensed professional involved in that arena, there's a lot of fraud possible because I don't have a doctor's license. I don't have some of the classic things you have to tell if you had a hernia operation, where I've got a lot of different ways of figuring out that it actually happened. So that's the kind of things we're talking about. Put some numbers on these. There's been a sevenfold increase in hospice services in California. I mean, Jillian, unless there's 7 times more people dying in California than a few years ago, there's a problem here. We have home health care building in Southern California, in LA County in particular, that represents 9% of all of the billing in America, like the entire
Wow.
country. That's
Wow.
that's 5 times more than you'd expect. So again, just the numbers themselves reveal deep fraud. And the problem that I'm forced to tackle is how did it become so systemic? Endemic. It's all over the place. When I was talking to whistleblowers and doctors who still were doing these sort of suspect practices and patients who'd been harmed, I kept hearing horror stories where it's sort of commonplace now in Southern California to pay a doctor to get their patient into your hospice facility, to buy beneficiary numbers. So you go to people on Social Security and you actually buy their numbers. There's a whole market for this. You
What?
can buy hospices for a couple $100,000. I'll tell you, this is a true story. I was talking to this guy who owns 5 different hospices, which, by the way, in itself is a question mark of like, why do you own five? I can just own one and do it right. They
Okay.
buy five because if you keep the number of patients in each hospice small, you don't have to report to the federal government. Anyway, he's building a
Oh,
massive house,
wow.
Jillian, a beautiful house apparently that he's telling me about with all these ill-gotten gains.